Children with disabilities are capable of overcoming barriers to their inclusion, of equally participating in society and enriching the life of their communities. But for far too many children with disabilities, the opportunity to participate simply does not exist. Hello, I'm Kuenzang, and we now bring you a program titled Children with Disabilities in Bhutan. This year, the International Day of Persons with Disability was observed on 3rd of December at Paro with about 80 students from Wongsel Institute, a special education unit for hearing impaired children, and Drugel Law Secondary School. Students displayed and sold crafts made from scraps and performed cultural programs gathered at Paro town. Disabled Persons Association of Bhutan also released a new audio album containing 6 songs, all written and sung by persons with disabilities. The album, titled Duden Luje, is dedicated to the 68th birth anniversary of His Majesty the 4th Drukgyalpo. Dupto Zangmo, a board member for the Disabled Persons Association of Bhutan, who was also present at the event, explains the importance of the day.
The World International Disability is celebrated every year by all kinds of disabilities, and today's theme is Inclusion Matters and Empowering and Accessibility. It's important to know that people living with all kinds of disabilities have all kinds of abilities, and they can do what they have, and given the chance and given the facilities, they have all the talents that other able persons have. And then today we are here in Paro town to stage our abilities.
According to the Population and Housing Census of Bhutan 2005, there are about 21,896 people living with disabilities in the country, of which the overall prevalence of children with disabilities stands at 21%, according to the Program Officer for Disability Prevention and Rehabilitation Program, Karma Dolma from Department of Public Health.
Actually, it's a question which needs to do again another study. With the study which was carried out through the support of UNICEF and through NSP, Child Disability Survey, they said overall prevalence was 21% for the children. So that way, maybe if we try to conduct another study, maybe after 4 years or so, perhaps we may have come across again more children. Or sometimes it may go down, but we never know unless we have another study in place. But to carry out such study is very expensive. Now, looking at the prevalence, it is quite high for our population. Yes. But this is in specificity of the child. Yes. But if you look at the overall population of disability, based on the Population Housing Census 2005, we have disability 3.4%. So now, based on our population, let's say now, for every 100%, we have 1 person who has been disabled. So that is quite high.
Karma Dolma also said most children with disabilities remain invisible to the mainstream population and relevant officials or the concerned authorities. There is little relevant data to identify the number of disabled children, making it impossible to carry out appropriate interventions.
We feel there are many cases that are not being detected, but from health, we do have a primary intervention in the district level as a primary approach. They try to detect and try to assess. So as a first primary prevention through primary healthcare approach, we have such measures that are being looked into. So through that approach, they go into the community and then also try to create awareness and advocate on such issues. So through such cases, they are being identified and assessed. If they are not able to do within their level, they are being referred to the district hospital. And at the district level, if such cases are not able to be managed, then they are being referred to the 3 referral hospitals.
Of the fewer appropriate interventions, education is known to be one of the most effective ways to break the cycle of discrimination and poverty that children with disabilities and their families often face. Teachers play a vital role when it comes to having inclusive education in schools which foster and nurture child with friendly environment in classroom. Well, let's hear what some of our teachers have to say on this.
It has brought tremendous changes in the students with hearing impairment, because quite often children with hearing impairment, our students, they tell us they are very lucky for having been admitted in the school. If they were left at home, firstly they would have been left isolated, because in their village there is nobody to communicate with them, and then whatever has been said they do not understand. Now after having been admitted in the school, they can do some reading, writing, which helps them for easy communication. And then in terms of social behavior also, now they get to mix with different types of people. And then before, when they came to school, these students, like if I share some experience of my past, it was in 2007. There was a girl who was brought to school, and then like she didn't want to stay in the school. She used to throw stones at me, and even in the classroom also. She never listens to me, and then whenever I see her, she gets irritated with me. Now she says that she regrets for having done. She's doing very good.
The teacher has to be really compassionate, love, caring, and above all, a teacher has to be really committed and hardworking and a good human being. Unless a teacher has such qualities, we will not be able to help children with special needs, because the work is such that the activities or the teaching has to be repeated all over again and again, and that takes a long time, and it can be quite tiring at times. But at the end, when you have changed somebody's life, you get so much of satisfaction that you could do something that people never thought that you would be able to do. Especially if I talk about my deaf children, when they first come here, they do not really know the norms or rules of the community, forget about the school. So after they come here, they are able to read and write, they are able to SMS, they are able to do Facebooking, and they are able to exchange or interact with themselves and with the hearing peers. And also their personal health and hygiene is improved. So overall well-being and happiness has really increased after they have joined the school.
Various civil society organizations like the Disabled Persons Association of Bhutan, including health and education sectors, have as well adapted their structures to ensure that all children, irrespective of age, gender and disability, can enjoy their basic human rights without discrimination of any kind. Certain measures have been developed to fit the specific needs of children with disabilities.
We have one school in Kaling, so most of the visually impaired are educated there and brought up. And then now Wangsel Institute is here to educate hearing impaired persons. And then we also have Changang Lower Secondary School, who also caters to the needs of physically challenged people. We also have Drakso Vocational Center. That vocational center also looks after all kinds of physically challenged persons. And then Ability Bhutan is one of the NGO that is established by the parents of disabilities, and they also look after the physically challenged and then other kinds of disabilities.
From the public health, we have a program called Disability Prevention and Rehab Program. But this doesn't specifically target towards children with disability, but as an overall, in a holistic way. Going in Dzongkhag-wise also, we have now, Zirang, I believe, has the highest numbers of disabled children specified as per the second stage child disability. So that way, we want to go in a stepwise, although we have many other programs targeting towards disability prevention.
Yes.
Through some programs like we do conduct. 2 years back, we had one program with the parents in Gidakum. Of course, parents has their frustration and there are many other heart-wrenching stories to tell. But we feel also as a parent, they also have a social, moral and obligations. They need to support their child. They need to seek support of such centers. Not only from health and education, looking into all these disability issues. We do have other organizations, civil societies. Like example, now we have the Ability Bhutan Society, a disabled people organization. Such organizations are there, and Draksos is also there to look into all this. At least they also try to address what government is not able to take up. So I feel that maybe if parents could at least take a step forward and then try to approach and then seek help lah, such centers lah.
Meanwhile, in order to cater to the needs of the children with disabilities in the country, the board member of Disabled Persons Association of Bhutan, Trupta Zangmo, says a policy plan has already been drafted which will be put up in the upcoming parliament.
Definitely, we should have a strategic plan that needs to be put in place in order to cater the needs of disabilities. And as a news, we have drafted a strategic plan, and I think it will soon come out. And then we have also drafted a policy that is also looked after by GNHC Commission, and then I think that will be soon put in the parliament.
Well, that's all we have for you today. Hope you had an informative time listening to the program. I will now leave you with some messages from the concerned officials highlighting the importance of partnership in promoting inclusive health, education and protection services for one and all. Thank you.
My message would be to the community that if we are considerate, if we are compassionate to help the children with disabilities, we can do in many ways. Even if we cannot extend help from ourselves, we could ask from other organizers or other people around, and thereby the lives of children with disabilities will be improved. So that's one message. Other message is that that's with regard to my institute. So if there are deaf kids, school-going deaf children, they should come and avail the facilities that the government is providing. That's all. Thank you.
The only message I can say is all disabled friends do not feel that we are left out, we are ignored. We are equally important as other able persons, and then feel that we can always do what others can do, and then always try to come forward and then speak out your voice so that the other people will know what our problems and challenges are. And through Disabled Persons Association, I always wish that we can always try to cater the needs of all kinds of disabilities, and all disabled friends, let's join our hands to help all kinds of disabled friends like us.
I would like to tell the people that just because they cannot hear doesn't mean that they are Tsagi or Tsagim. Actually, we are same. They are like any hearing people. The only defect, the only disability that they have is they cannot hear. So it is because they cannot hear, they cannot speak. That is the only problem. So I would like to request the public not to call them Tsagims. Yes.
One general message that I'd like to share with the general public is all disabled people are not disabled. They have their potential. What we need to give them is we need to support and help them and give them a chance to show their capabilities.